Good afternoon, sir. How are you, sir?
I'm very good. Good afternoon.
Welcome to Beani Bazaar Cancer and General.
Thank you very much.
So, how you feel? You visited our hospital. How you feel?
Well, I remember going back about 10 years ago when this hospital was a kind of an idea and a vision, and I've been working with a team for a long while on some of the how to deliver a cancer hospital. So it's really nice for the first time to see it actually being built and being used. I'm very impressed with the standard, also the size of the hospital, but also the way it's being managed. It's got quite an excellent laboratory service. It's got diagnostics like ultrasound and x-rays and imaging. Also, it's got many consulting rooms and an operating theatre. And this is great for the people who may have cancer, potentially to be screened or indeed be treated for the disease. So I think it's an amazing opportunity and a great, I guess, hospital that's been built by a community through donations for free, which I think is amazing for our country and particularly for Beani Bazaar.
Thank you, sir. So, what is the suggestion? How can we develop in future?
I think we need to make sure that we offer good screening services. So I think the best thing here is say what are the areas of cancer we're interested in, how do we screen that better, how do we persuade and educate the public here in Beani Bazaar and wide in Sylhet to understand the symptoms that be of concern and to come early for diagnosis, because the earlier they present, the more likelihood they have of curing the cancer. So it's got to be that, the prevention kind of thing. Also, those that do have cancer should be offered expert treatment with the right clinicians and right support to be able to access the care they deserve.
Okay, thank you, sir. So earlier on, you visited a poor patient who is suffering from cancer, rectal cancer. So, the cancer patient in Sylhet, not only Sylhet, in all of the Bangladesh, is increasing day by day. So, how can we help them?
I guess, again, it's about having access to services. It doesn't matter how poor or rich you are, you need good healthcare. I think that's what we need to think about. Democratising healthcare, making it accessible and affordable for everybody. And once it is accessible, to give the patients the best opportunity. And that means good diagnostics and clinical reviews, and also the right treatment with the right specialist. It's about offering world-class treatment, or at least the treatment that the patient has the best outcome. Many of these patients can be potentially cured. Okay, therefore, by getting early, treating the right way, you get a lot of patients who will be cured of their disease. Those that can't be cured can still be managed for long term to increase their length of life, to increase the quality of life. I think that's what we should be offering. As well as palliation, some patients may come with end-stage disease, and therefore our role here is to palliate them, make them comfortable, and to understand better their illness. It's all about education, and it's all about patient empowerment, which I think needs some work on, but at least this institution is striving to make those changes.
Yeah, well said, sir. So we have some plan for online treatment. So if we need your support from UK, so I hope we'll get your support from UK.
Of course, I think having more opinions is the right way forward. Cancer services, cancer work involves teamwork. It's not one individual. Most people will have what's called an MDT, a multidisciplinary team meetings for all cancer work. And I think thinking about wider international collaboration, getting wider opinions, expert opinions, makes sense. And in the world that we live in, where we're more connected, we can actually remotely make a phone call or do a telemedicine phone call. There's no reason why we can't bring people in on a remote platform and give them advice they need. And I think that's great. And this is where the future lies, of course.
Thank you, sir. Thank you so much, sir, for visiting Beani Bazaar Cancer and General Hospital. So, thank you so much again for your valuable time. Thank you so much.
Many thanks. Thank you so much.